Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Frontal lobe. This frontal lobe, mainly physiologically, frontal lobe contains. It is the center. Frontal lobe is the center for judgment. It is a center for judgment, insight, and also foresight. Behavior is situated in the frontal lobe. Then, starting initiatives or creativity, and also curiosity, emotions, all these are parts of frontal lobe. And then frontal lobe is also important in micturition because paracentral lobule is a part of frontal lobe. So micturition is also an important part of frontal lobe. Okay, now because paracentral lobule, actually the paracentral lobule is a part of frontal lobe. So obviously micturition is also a normal part of frontal lobe. Now if there is frontal lobe lesion, this frontal lobe lesion has many parts. First we have, according to frontal lobe lesion, we have Foster Kennedy syndrome. Then in Foster Kennedy syndrome, first the patient will have ipsilateral optic atrophy will be seen with contralateral papilledema is seen in the Foster Kennedy syndrome. Foster Kennedy syndrome is a frontal lobe lesion, and here you will see presence of ipsilateral optic atrophy and also contralateral papilledema is seen. Then if there is a lesion in prefrontal framework, prefrontal network damage. This prefrontal network damage is associated with two symptoms which is called as frontal disinhibition syndrome, and we also have called as frontal ABULIC syndrome. This is important here. There is prefrontal cortex is damaged. So as a result, first we have frontal disinhibition syndrome. What is frontal disinhibition syndrome? Here disinhibition, that is the patient is socially disinhibited. What does this socially disinhibited means? That means there is loss of, here the patient will have loss of judgment, the patient will have loss of insight, judgment, and also foresight is lost in the patient because of this social disinhibition. That means there is antisocial behavior is also seen in the patient. So there is a simple story of a person. I don't remember the name of the person, but he is a worker. He is a worker. He is very good. He is empathetic, sympathetic, proper, happy worker. But unfortunately, one day, due to some accident in the during the work, due to some accident, he has developed a rod. Actually, a rod has went into his brain. Accidentally a rod pierced the brain of the person like this, and so such that the frontal lobe is separated from whole of the brain. So when the frontal lobe is separated from whole of the brain, this frontal lobe obviously it has gone atrophied because it is in the old age, it is in older ages and earlier ancient times. So the proper treatment was not there. Many people thought he could not survive, but fortunately the patient survived. But after before the accident, he was very empathetic to his fellow workers. He was happy, he has good social relationship with everyone, he is emotional, he is completely a normal human being. But after the lesion, because of the loss of this frontal lobe, or because of the separation of this frontal cortex from rest of the brain, now the patient always starts with fights. He is aggressive, he starts fighting with everyone, he does not understand the emotions, he does not understand judgment, he lost everything what is meant to be a human. So this is frontal disinhibition syndrome. Then we have frontal ABULIC syndrome. In frontal abulic syndrome, as the name says, here the patient is first abulic syndrome, so there will be loss of, here there is loss of initiativity, there is loss of creativity in the patient is lost, curiosity of the patient is lost, and there is pervasive emotional apathy. He is not able to understand any emotions, and he is not able to show any emotions, so blandness is present. He is not able to understand emotions, nor he is neither able to understand emotions, nor he is able to show his emotions. He is always does not talk, he is abulic, he is always mute. That is akinetic mutism is also seen in this person. So this is frontal abulic syndrome. Then whenever there is frontal lobe lesion, okay, frontal lobe lesion, it is, these are also associated with urinary incontinence can occur in frontal lobe syndrome. And also you can also see the frontal release signs, like actually the grasp reflex, and also signs like grasp reflex, response, and we have rooting reflex. Actually these grasp reflex, mental response, and rooting reflex are lost in the childhood, but if there is a frontal lobe lesion, these reflexes will come back.
Thank you and thank you for watching.